Extracorporeal shockwave lithotripsy is safe and effective for pediatric patients with chronic pancreatitis. Introduction. Chronic pancreatitis is characterized by pancreatic inflammation and fibrosis, which eventually leads to the destruction of the pancreatic parenchyma and loss of both exocrine and endocrine function. Recent studies have estimated that the incidence of chronic pancreatitis in children is approximately 0.5 per 100,000 per year. Despite this modest incidence rate, the disease burden of chronic pancreatitis in pediatric patients is substantial owing to the extreme disruption caused to the patient's childhood and education. Children with chronic pancreatitis typically suffer from chronic or severe relapsing abdominal pain, with frequent emergency department visits, hospitalizations, and school absences. Moreover, malnutrition caused by decreased dietary intake and malabsorption is known to retard the growth and development of these children. Pain control is the mainstay of chronic pancreatitis management. Characteristic pathological changes, such as pancreatic duct stricture and stones, lead to intraductal hypertension, which is the most important factor for abdominal pain. Pancreatic stones are present in 50% of patients with chronic pancreatitis and 12% to 69.7% of pediatric patients with chronic pancreatitis. Treatment of pancreatic stones in adults is standardized, with guidelines available. Surgery and endoscopy represent the first-line therapies. However, a consensus regarding the treatment strategy for pediatric patients with chronic pancreatitis is not available. According to previous studies, for pediatric chronic pancreatitis coexisting with pancreatic stones, surgery and endoscopy are also considered safe and effective therapies. Because of the irreversibility of the disease, children with pancreatic stones have a higher risk of recurrence over a longer period of time than adults, therefore indicating a higher cumulative likelihood of stone recurrence throughout their lives. Pancreatic extracorporeal shockwave lithotripsy, PESWL, is minimally invasive, effective, and safe for the management of adults with pancreatic stones and does not impede subsequent endoscopy or surgery in patients with recurrent stones in the future. However, the safety and efficacy of PESWL in pediatric patients has not been previously reported. The main concern with regard to the application of PESWL in pediatric patients is the potential for complications of the procedure, such as acute pancreatitis, perforation, bleeding, infection, and anesthesia-related side effects. The aim of this study was to evaluate the safety and efficacy of PESWL in the treatment of pediatric patients with pancreatic stones. Background and study aims. Pancreatic extracorporeal shockwave lithotripsy, PESWL, is recommended as the first-line treatment for pancreatic stones. However, how well PESWL performs in pediatric patients remains unclear. Wang et al. Aimed to evaluate the safety and efficacy of PESWL for pediatric patients with chronic pancreatitis. Methods. This prospective observational study was conducted in patients with painful chronic pancreatitis who underwent PESWL. Patients aged under 18 years were included in the pediatric group. Patients aged over 18 years who underwent PESWL in the same period were assigned to the control group. For investigation of long-term follow-up, the pediatric group were matched with patients from the control group in a 1-to-1 ratio. The primary outcomes were PESWL complications and pain relief. The secondary outcomes included stone clearance, physical and mental health, quality of life score, and growth and developmental state. Results. From March 2011 to March 2015, PESWL was performed in 1,135 patients, 72 in the pediatric group, 1,063 in the control group. No significant differences were observed in the occurrence of PESWL complications between the two groups, 11.1% versus 12.8%. Among the 67 pediatric patients, 93.1%, who underwent follow-up for 3.0 years, range 1.3 to 5.2, complete pain relief was achieved in 52 patients. 52 of 67, 77.6%. This value was not significantly different from that of the matched controls, 55 of 69, 79.7%. Conclusion. PESWL is safe and effective for pediatric patients with chronic pancreatitis. It can promote significant pain relief and stone clearance and can benefit growth and development.